Hi, I'm Dr. Yuri Kerbal, and today I want to talk about a topic that comes up all the time with my patients, and that is how long does a knee replacement last for? And will I need to get a second operation down the line to get the knee revised? Now, traditionally, we told patients that knees last about 15 or 20 years, and then you'll probably have to get them replaced. But to be honest, this was more of an educated guess than anything else. However, there's now been more research coming out about the longevity and durability of knee replacements. And so what I wanted to do in this video today is look into that research with you to give you understanding and peace of mind about how long your knee replacement is going to last for. Now, before we get into the research, there's one thing I want to say. A lot of times online, people will say the research says or the science says, and they don't really comment on the quality of the research. And when you're looking at research, it's really important to understand the quality of what you're looking at and to understand the drawbacks about how it can be applied to you. What I want to quickly do is just address a few drawbacks about research to do with knee replacement so that we're aware of them and understand them when we're interpreting these results. So, first of all, let's talk about the fact that not all results can be generalized to all situations. So sometimes you might be talking about just one specific hospital system, or just one surgeon doing the cases, or just one type of knee replacement, or just one geographical area. And those results, while they give us insight, may not be applicable to other situations that are different. So it's important to keep that in mind when you're looking at smaller studies that are focused on a smaller area of focus. Second of all, garbage in is garbage out. A lot of times what studies will do is they'll look at things like systematic reviews or meta-analyses, which, to put it simply, are studies that aggregate other studies. They put them together and look at the results of all of the different studies to see if they agree with each other, where there are points that seem to be proved across the literature, and where there are things that studies may differ on. And while these studies can be very useful, it's important to note that you have to know the quality of the studies that they're including in their reviews, because if they're including bad studies, then those results aren't going to be very good no matter how many studies you pull together. If you pull together a bunch of garbage, it's just going to be more garbage. It's not going to be better. So it's really important when you're looking at reviews or meta-analyses that you also look at the quality of the studies that are being included in those. Next up, it's important to know that there are lots of different types of knee replacements. There's different ways of doing the surgery. You can keep the PCL, you can take the PCL, you can cement it, you can do it uncemented. I'm not going to go into the boring details about all these different ways, but the truth is that these little differences in the way the prosthesis is done, the way that the surgery is done, or the type of prosthesis used can make a slight difference in the outcome. And so if you see a study that looks at a specific type of prosthesis, it doesn't mean that those results apply to all others. Now, where it can be useful to look is registry studies, which we'll get to in a second, which look at a population level, and they can actually compare different prostheses. And while this doesn't make a huge difference, it is important to know because there are little nuances that can be different when different implants are used. Also, this is old data that we're looking at. When we're looking at long-term outcomes, we're talking about cases that were done 20 or 30 years ago. Now, knee replacements have come a long way in the last 20 or 30 years. The operation now is very different than the operation it was back then. We have better implants, better techniques, better materials, better understanding of knee anatomy. And so I actually think that if you look at the data from what's coming out today, it's going to be a lot more longer lasting than these studies. So when you're looking at these studies, keep in mind, this is done with old, worse prostheses and worse ways of doing the surgery. And so the results from today are likely going to be even better. Also, there are a huge number of variables. If you're looking at experiments that are things like rats in a lab or little molecules, you can pretty much control the entire scientific setting. You can control all the variables and just change one of them. And that's what science is about, changing one variable and seeing how others change as a result. With human beings, it's much harder to do because there's so many differences between all of us. Think about it. Every patient has different background, different health problems, different socioeconomic background, different levels of activity, different levels of support at home, or how likely they are to have an accident. Like we said before, different prostheses, different surgeons, different locations. All of these things have an impact on outcomes. They're what we call confounders. So even if you're doing a very well done randomized controlled trial where you're trying to just keep everything the same and just change one thing, the reality is with these kind of human studies, you can't control everything else. And so it's important to know that while we try and control and try and make these studies as focused as possible, there's always going to be a lot of what we call confounders, which are other things that may be affecting the results. So now that I've got those caveats out the way, it's important to note that the research is still very valuable. It gives us great information. I just wanted you to understand that before we look at it, because I feel like a lot of times people say the research says and everything's just accepted. I want you to know that when I look at these studies, I look at them with a critical eye. In fact, I actually review for a number of prominent orthopedic journals where my whole job is to look at studies and poke holes in them before they're published to make sure that they're scientifically worthy of publication. So now that we know that, let's take a tour of some cherry-picked studies that I found through the research that I think will give you a better idea of how long knees last for. This is not every study that's been done, because if I did that, you would be extremely bored and this video would be an hour long, and I don't want to do that. I just want to give you information so that you know how long a knee lasts, okay? So let's take a look at a few of these studies and let's see what they show. First up, we have this study that was done in the Journal of Arthroplasty, which is one of the most widely respected joint replacement journals in the world. And this was done in 2015. And what they did is it was a prospective database. So they took patients at their one institution, they operated on them, and then they followed them going forward. And they only used one type of implant, and they also looked at aseptic, non-infected implant survival. So they excluded cases that got infected, which is only about 1% of cases. But still, all of these things make, lessen the results to some degree, but still, overall, very interesting study. They followed these patients for 10 years after knee replacement, and they found that 99.9% of patients still had their knee in and working at 10 years after surgery. Now, it's important to note, when I say survival, that doesn't mean human survival. It means knee survival. It means the knee was surviving. It was still in place in these patients. So 10 years out, 99.3% of patients still had that original knee in place. Pretty good. This is another study. This is also from Journal of Arthroplasty, a bit more recent, 2021, and they looked at 266 patients, also at one institution. This one was a little bit different in that they had patients undergoing bilateral knee replacement, which means they had both knees replaced at the same time, which is a little bit different and does affect things somewhat. But also, again, well done study, and they looked at these patients for a long period of time. They found that 5 years after surgery, 99% of knees were still in place. Again, survival means of the knees, not of the people. The people were surviving. It's the knees we're talking about here. So 5 years out, 99% of knees were still in place. 10 years out, 92%. 15 years out, 83%. And at 20 years, 62%. So these results are a little bit more sobering than the other study. But the amazing thing is that almost 2/3 of patients still had their knee in place at 20 years after it was put in. So when we were telling patients before that knees wear out after 15 or 20 years, it seems like even in this conservative study, at about 2/3 of patients, almost 2/3 of patients at 20 years time, simply wasn't true. The knees were still in and still working, which is amazing to know. Next up, we have another study. This was done in The Lancet, which is a great journal out of the United Kingdom, one of the most well-respected journals there. And they looked specifically at this question: how long does a knee replacement last? And what they did was a systematic review and meta-analysis. So a systematic review is where you go through the literature and you look at a whole bunch of other studies that were published on the same topic, and you aggregate them together and you see, do they agree with each other or not? On which points do they agree? On which points do they disagree? Meta-analysis is where you take this one step further and you actually combine the data from some of those studies so that you kind of pool them into a larger group of patients, which theoretically can give it more statistical relevance. It's a little hard to do often because studies look at different statistical parameters. And so it's not so easy to combine these together, but that's what they did. And they looked at dozens of case series, which means journal articles that were published with series of patients. And they also looked at 300,000 knees that were taken from registries in Australia and New Zealand. So registries, I mentioned them before. What a registry is simply a database taken in a specific country of all the knee replacements, or at least hopefully most of them, if not all, that are done, so that they can track how the patients do going forward. And this gives amazing data about how the patients do, which surgeons are good, what combinations of implants, which prostheses, as we call them, do well, and all manner of other things that can lead to good or bad outcomes. So this is really interesting population level data, and they took two registries from Australia and Finland and looked at about 300,000 knees from those. And then they did some fancy statistical work to try and weight the results, which just means give them a relative importance, one next to the other. And what they found is that looking at all this data together, they found a 25-year survival of 82.3%. So that's much more optimistic than the study before. And that's amazing, right? 4/5 of patients, 25 years out, a quarter of a century out from having the knee was still in place. That is really amazing. And again, flies in the face of what we told patients before. It's not 15 or 20 years. Looks like for most people, it's actually much longer than that, which is really awesome. So talking about registries, let's look specifically at one. This is from the Australian registry. The Australian registry is really well done, and I think they capture almost every single surgery. They do a really good job of not missing any data. And this is from their most recent report from 2024. They looked at hundreds of thousands of patients over decades, and they found that the 10-year survival of knee replacement was 90 to 98%, 15-year survival 89 to 96, and the 20-year survival 86 to 92. So this is really amazing. Again, they're saying that 15 or 20 years out, the vast majority of people, 80 to 90% or more, still have their knees in place. So again, the old adage of your knee's going to wear out after 15 or 20 years just doesn't seem to be true. It seems like these knee replacements are lasting much longer than that. Now, this was an interesting study also. This was another registry study. This was done in England, and England has an excellent joint registry. They're the longest lasting one. They're very big. They're very well organized. They did a study looking at their own registry that looked at 1.7 million patients over 17 years. And they found a 10-year survival of 96.8% and a 15-year survival of knees of 95.4%. So again, 15 years out from surgery, the time that we used to tell patients you might need to get your knee revised, 95% of those patients did not have their knees revised. The knees were still in place and still doing okay. That is remarkable. One thing that they did bring up in this study, though, and this actually did come up in some of the other studies that I just mentioned before, was that there is a slightly higher risk of revision in patients who are younger. In other words, they say under 65, but traditionally we call young patients under 55. It depends on the study. Either way, they said that those patients have a little bit of a higher risk of needing a revision down the line. And if you think about it, that makes sense. If you're younger when you get your joint replacement, you have a lot more years to put wear and tear on that knee, and you're probably going to be a bit more active, right? Because you're younger, you're still in better shape. And so those kind of patients do need to know when they're getting a joint replacement that it may wear out down the line, and they are a little bit higher more likely to need a second surgery compared to other older folks. However, looking at some of this other data, it's pretty darn reassuring. And it seems like even if you are going to need to get it revised down the line, hopefully we're talking decades down the line. And that original knee replacement should hopefully get you through your most active vital years, which is really important. And this study, talking about long-term survival in younger patients, I thought was really interesting. This was the longest follow-up that I could find online. And this was a study that they looked at both their own patients and patients in the literature, and they saw specifically for patients under the age of 55. So they were looking at that cohort we just spoke about, the younger patients who are more likely to need a revision. What about these patients? How long do knees last in them? And their results are amazing. So their 10-year survival was 91 to 99%. 20-year survival, 84 to 96%. 25-year survival, 70%. So a little bit more sobering than the last study, but still pretty darn good, almost 3/4. And again, this is in the younger patients, the one who have a higher incidence of revision. And at 40 years out, we're talking almost a half century from getting your knee, 52 to 65% of knees were still in place. That's unbelievable. And this is with really old knees. 40 years ago, a total knee was not a good operation. It was nowhere near as good as it is now. Now we have so much better technology, so much better implants, so much better surgical technique, so much more technology to help us, everything that makes a better outcome. But even with this much inferior knee, 40 years down the line, 52 to 65% of people still had their knee in place. And this is the younger population who were more likely to need a revision. So even in those people, more than half of them still had the knee in place all those years later. And to me, this is just unbelievable to see. So I thought this study was fantastic. So overall, what have we learned from looking at these studies? First of all, total knees last longer than we thought. I also used to say that thing to my patients where I would say a knee lasts about 15 to 20 years, and then you might need to get it revised. After looking through these studies, I don't think that's true anymore. I think that for the vast majority of people getting a knee replacement, it's going to be a one and done surgery. Get it one time and it should last you for the rest of your life. For the younger patients, it might be a different story and you might need another surgery down the line. But even then, hopefully, it's still going to last you decades, keeping you active, keeping you pain-free and mobile during the most important years of your life. And looking at these studies, about 80% of knees are still in place 25 years after they're put in, which is absolutely remarkable. 4/5 of knees, thereabouts, still in place, still working 25 years after they were put in. Even at 40 years, like we said in that one study, more than half of knees are still in place, still working. Realistically, most people who get a knee replacement are not going to live longer than 40 years after they get it, considering that most people who have arthritis are, middle-aged or older. So again, this reinforces that optimistic data that hopefully for the majority of people, you get a knee once and that's it for the rest of your life. The people who do have to be thinking about this a little bit more, and the ones who should have discussions with their surgeons, are younger patients under 55 or under 65, if you want to push that a little bit, and they are at a slightly higher risk for revision, as we mentioned above. But overall, looking at this data, I came away from this feeling very optimistic, very upbeat, and very excited about what this means for my patients. And I think the takeaway is, if you're thinking about getting a total knee, it's not a case of get it done and hopefully it lasts you 15 or 20 years and then get it redone. Hopefully it lasts you for the rest of your life. We have a whole bunch of data now showing us that whether you're looking at registry data, whether you're looking at case series, depending on different regions around the world, it seems like knee replacements are lasting for decades after they're put in. And considering that the knees that we do now have better implants, better techniques, better alignment philosophies, better materials, better technology, better everything, I think the results from the knees we're putting in today are going to be even better than this. And this makes me feel excited for my patients. And I hope you feel the same way after watching this video. So that's going to do it for this video today. Hope you enjoyed it. Hope you got something out of it. And I hope that, like me, you come away with a renewed sense of optimism and excitement about the longevity and the durability of knee replacement surgery. I'd love to hear your thoughts in the comments, and I'd also love to hear any topics that you'd like me to cover in a future video, because I want to make sure that all the videos on this channel are catered to the questions that you want to know. Also, please make sure to like and subscribe so that other people can find this video, and also so that every time I post a new video on hip or knee replacement, you get notified. We have a bunch of great topics coming out in the coming weeks, and I'd love to share them with you when they get published. So that's going to do it for me today. Until next time, I wish you the best of health and a happy, active, and pain-free life. Take care.